May I request Dr. Madhu Shashidhar to felicitate Honorable Health Minister? May I request Honorable Chief Minister Shri A. Revanth Reddy Garu to kindly inaugurate Apollo Financial District. Thank you, Honorable Chief Minister. Thank you, Honorable Chief Minister. We are truly grateful for your presence and support. Telangana's aspirations inspire us, and your trust strengthens our purpose. Apollo Hospital's financial district is a next-generation, multi-specialty facility designed to combine advanced clinical care with a patient-centric, healing environment integrated with the latest in technology and innovation. Ladies and gentlemen, may I take this opportunity now to call Dr. Sangeeta Reddy and hear from the visionaries who continues to inspire us and guide us forward. This is going to be a strong fireside chat where we'll hear from the leaders themselves. Dr. Sangeeta Reddy.
Good evening, ladies and gentlemen. Namaste. Today is a very special day. It's actually Mohini Ekadasi. During the Samudra Mantham, today is the day that the Amrutam came out. This is the nectar of infinity. So the God's grace and the CM's calendar enabled us to have this on this special day. So may we be able to take the beauty of that Amrutam and give it to people across our communities, across our fantastic state, across the country and across the world. So welcome, namaste and good evening to our Honorable CM, Arumula Revanth Reddy Garu, Honorable Health Minister, Damodar Rajanarsma Reddy Garu, our legendary and iconic Chairman, Dr. Pratap C. Reddy Garu, and to all of these three. Your 76th hospital is here. You began in Chennai in 1983. Chairman Dr. Reddy, can you please share with us, Chairman Dr. Reddy, can you please share, can you please share with us your vision of this journey, the journey of caring? How do you see this unveil over the next few years?
1983, when I started Apollo, it looked as though it was today, because the memories are very fast. I did for a single purpose. My patients, I'm a cardiologist. I could do everything in cardiology, but there was no acceptable cardiac surgery program in the country. And then only very small number of people, the rich and the powerful, could spend $50,000 and go abroad. And that's what made me, when I used to lose patients who couldn't afford to go that. One of those days, I saw many I lost. That one, that picture in me, she still comes to think. A young man, 38-year-old, who had a wife and 2 children. And when he lost, when I saw that wife and 2 children, it completely shattered me. I said, this should change. If Indian doctors can do, wonderfully well overseas, why can't we have it here? But it was not easy. I went to Delhi as a student. and a round trip. But second time to go for this was not easy, but I'm happy. The government, many trips that happened. All the pleasant thing is when we opened the first hospital by the then President of India. From then on, when we could change the various acts to facilitate hospitals like any other industry. And that's what made India today. I think all of us must feel proud that it's not just Apollo, 76 hospitals. There are another 300 good hospitals in the country who has made India proud. And I told our Prime Minister saying that we can declare India as a global healthcare destination. And then gave him 10 steps how it can do. So, and the second thing I suggested was, the world is shortage of 8 million doctors, nurses, paramedics, and then India has the largest number of younger people. If you can only give an opportunity to that. I accepted both. I called it Global Healthcare Destination and Global Workforce. He only changed the name as Heal India, Heal by India, because he says Sushruta did the 750 BC. Thank you. Because of this, today we have all of these hospitals coming up, and I'm sure Heal in India will make India, in my terms, global healthcare India, and the world, people in the world will come to us. Hyderabad is a very important thing for us. I think from day one, when I took that 30 acres, people called me crazy out on the top of a mountain because of the care that we give. We want, the infection should not be there. This is why I took that mountain, and today this is my prestigious hospital. For Telangana, again, this is our 5th hospital. We won't stop here. This year, this is our 3rd hospital in the state, but I promise you, we'll do more hospitals in this state and continue to keep MedCity as a star for the world to see. Because we have everything in that platform. It's just not hospitals. We have the IT. Shobana is sitting there. She made 24/7. Our med skills, home care. All of these branches are all sitting there, and that rehab center. But we'll go into the next development. This hospital is not what Jubilee Hills is. This is one step ahead on technology. Upasana, you made all that message to make. So I think we'll continue to do that. I only promise to thank the Honorable Chief Minister and the Health Minister, saying thank you for coming here, and with your encouragement, I will. My intention is people should be happier, healthier. Our future vision is H at H, health, happiness at home, where all of our programs are working towards this achievement of that health happiness. I'm sure with the dynamism that you've already shown, we will do more and we'll continue to do it.
So, thank you, Chairman. As all of you know, the vision goes on. So, Telangana is one of the fastest rising states, and in Telangana, the Hyderabad and this area, financial district, ORR, etc., really stands at the intersection of emerging aspirations of people, evolving science and technology, because all those advancements are happening right here. And we are proud of our Chief Minister, of the pace at which we're progressing, and of the joint health policy. So may I request our Health Minister to share with us his thoughts on PPP, how public and private can work together to make a better environment for people. I also want to add that this is the place in Andhra Pradesh, the United Andhra Pradesh, in the village where Chairman was born, that we started the 1 rupee a day insurance scheme. That scheme then came to the police force as Arogya Bhadrata. Then came to the entire Andhra as Arogya Shri. That concept that the whole country can be covered or a whole state can be covered happened here. And with insurance, the private sector developed as well, because there is a funding mechanism. And this was his dream, that people should have access to care, and we can enable it only through insurance. So how can we work further in PPP together, that we serve, and also that we work on scientific innovation and discovery, which I know our Honorable Chief Minister is very committed to.
Thank you, ma'am. It is an honor. After a very long time, I met the chairman. He inspired us.
Yes, he does.
His dedication, his commitment, his vision is an inspiration for the generations to come. With regard to the policy of the government, Telangana government, my Chief Minister is very passionate about two subjects. One is health, one is education. And these two subjects are very near and dear to the common man and the families. He always believes education with skill, comfort, secured and nutritious food. With regard to health, our commitment is, as ma'am has rightly said, the Rajiv Arogya was designed in 2006 and 7. When our government has come, when my Chief Minister Revanth Reddy has heading the government, there was a commitment that we will enhance the expenditure of the family per year from 5 lakhs to 10 lakhs is one. Secondly, we have revised the rates of all the procedures. We have increased by nearly 20%, which has burdened us to a tune of about 400 crores. And the procedure also, we have increased the procedures to, we have added another 183. With regard to the overall policy of the health, affordable, accessible, equitable health services to the common man is the goal. Today we got nearly more than 40,000 beds, whether in the secondary health, primary health and the teaching hospitals. We got about 35 medical colleges, about 17 nursing colleges. So one side, the teaching hospitals, the nursing, the other side, service to the common man. We are more concentrating on the NCD, non-communicable disease, particularly the diabetes, the cancer, the HT. Moreover, apart from this, the huge runways, highways, accidents, the black spots, we have added about 213 ambulances about 1 year back. We are ready to add another 100 ambulances. And every 35 kilometers, we would like to establish one trauma care. Every 35 kilometers, or the maximum 40 kilometers. Similarly, the screening for those citizens who have crossed 30, particularly with regard to the cancer. And the aim of the government is that 90% of the treatment should be available at the district level. Only 10% at the capital, 90% at the district level. We have started the NCD clinics. We have started chemotherapy at the district level. We have made cancer a notifiable disease. We are maintaining a registry as per the ICMR norms. In this way, and moreover, recently we have taken a policy to establish another 79 dialysis centers. Already we are running 102 dialysis centers. We are going to start another 79 dialysis centers under the PPP model. So our concentration is on NCD, keeping in view the referral system. Somewhere we are weak in the referral system, whether it is the PSC, whether the PSC, the CSC, the area hospital or the teaching hospital. The first and the primary thing is the referral system should be strengthened. The overall policy of the government with regard to the health, where the government is uncompromised. If the government is uncompromised, we want to today almost 140 crores we are spending every month on Arogyasri. 140 crores, where the share of the private hospitals, empaneled hospitals is about 50%, and the share of the government is about 50%. And we want to strengthen the secondary health. In 1986, the then Chief Minister, N.T. Ramarao, has brought in the Vaidya Vidhan Parishad. It was a long cherished dream of the doctors who are working in the Vaidya Vidhan Parishad that they want the treasury salaries. They want an assurance, a legal protection. And my Chief Minister was very keen that we should convert it into a secondary health. And we have successfully brought the bill, we have brought in an act, now we are framing the rules. So for the government, the secondary health is the most important sector. So we got an overall vision for the common man with regard to the health.
Thank you so much, Andy. That was so meaningful. I think every point that you were saying, I know that our chairman was thinking, yes, this is something. So whether you spoke about the emergency services, he was the first one to convert the concept of casualty into emergency service. In Hyderabad was launched the first wireless connected ambulances. We are privileged. I'll hand over to you in a minute, Chairman. In one sec, we're privileged to do 7 of your highway emergency, and along with the national policy, we will be happy to do highway emergency programs on education, training, postgraduate teaching, research. Each one of these offer opportunities because the talented clinicians are sitting here. You spoke about notifiable disease of cancer. The seminal paper on notifying cancer came from one of our doctors in Chennai. But I know the Chairman's biggest passion subject is non-communicable disease and screening. So Chairman, would you like to please share your vision on prevention and of course anything else?
I just wanted to say about the casualty. I remember the day before the President was to inaugurate the hospital, I drove in, I saw the board, red board, casualty. So I went to them and then said, our patients come here to become casualty for you? This is terrible. I want this name to be changed as emergency. So we changed by that night, they changed the emergency, and I'm happy. The whole country, it's all now emergency, and they're giving that level of treatment. The second thing I wanted to say is, I come from a small village. We look after about 50,000 people in that mandal. For 40,000 people, we look after the complete total health. There is no neonatal or maternal mortality in Tavanapalli Taluk of Chittur district. And even during COVID, their mortality was 0.8% like any place anywhere in the world. I think this is what we want to do as a social service. Another thing I want to say is, I did not mention, our next focus is continue to do the curative process, adopting the latest technologies, but we must prevent these non-communicable diseases, all 4 of them, heart attack, stroke, cancer, diabetes, infections, all of them need not die if we can diagnose. This is why we want our thrust is preventive health. Preventive health, we named it as Mass Health Checkup, Apollo Health Check. Today it's called Pro Health. It will reveal early enough so that you can detect the disease and ask them how we can prevent the attack, or detect and cure the cancers early, can be cured. We have done that, and in the same, this one, as an opening before the Chief Minister and the Health Minister, I want to say that we want to do 10,000 on Sundays, 10,000 free health checkups for people in this area. And another major announcement, first time for the country I'm going to announce, saying Apollo never sleeps. You know what that means? Every Saturday, every Deepavali day, every Telugu New Year's Day, on all days, Apollos will work as a normal day, because you know why? Disease has no holiday. Disease doesn't have time. It has no holiday. So we will work 24 hours of emergency, but we will have continuously from here. I'm happy to announce before the Chief Minister and the Head Minister, but this is the announcement which is effective from May 1st, that all our hospitals will work on Sundays like any other normal day. All surgeries, everything will be done as normal. They are all ready and all the hospitals are prepared. Every doctor, every member of Apollo family have all agreed for this date. May 1st will be. So I think two important things is we want people around us to feel healthy and happy, and so that free checkup of 10,000 free checkup. The number of course came again from Upasana. So we'll have the free checkups done for poor people, and then open up Sundays. Thank you.
Thank you, Chairman. So all of us are so aware that prevention is something that's so dear to his heart. So 10,000 free checkups for the people around this area. There's a registration process. This will happen on Sundays. And I'm sure all the talented doctors in this room are going to help cooperate to make this a major reality. Thank you all. Each one of you are, a doyen in your field. You're skilled, you're talented. We have robotic surgery, we have transplant specialists, we have subspecialists, and everyone will come together with the dual vision of curative and preventive healthcare. Now, our Honorable Chief Minister, he stormed into the stage and made impact like none other. He has transformed so many areas. We're all proud of you, sir. One of the areas which is very, very close to his heart, besides the schools and the education, is youth. So on this fantastic occasion, we also want to announce that a hospital of this nature, 400 beds, directly employs almost 2,000 people. So healthcare is a socio-economic engine. So sir, you have just inaugurated the addition of 2,000 direct beds and approximately 10,000 additional jobs in your state for your youth. And I know this is critical for you. But beyond that, you have also inspired us to do so much more. So we will continue to partner. And now on this special occasion, we look forward to you please sharing your vision of how we can work together, partner further, and also your message to our doctors and our team.
Thank you, Sangeeta Garu, Pratap Reddy Garu and Apollo team. ఈ అందరికీ అపోలో హాస్పిటల్ ఫైనాన్షియల్ డిస్ట్రిక్ట్ ప్రారంభోత్సవ సందర్భంగా శుభాకాంక్షలు. 46 సంవత్సరాల క్రితం చెన్నైలో ప్రారంభించిన అపోలో హాస్పిటల్ 150 బెడెడ్తో స్టార్ట్ అయింది. 46 years జర్నీలో 76th unit you have inaugurated. Apollo is a role model for the country. All these years, Apollo has created hundreds of hospitals in different names. That may be AIG, that may be Yashoda, that may be anything. That may be anything in India, I can say proudly. Pratap Reddy Garu has designed like anything. He has shown a pathway to how to build a corporate hospital for a layman, poorest of the poor, who can get a better treatment with the minimum charges. So he has laid down a roadmap. That is the biggest task in India. We don't have any infrastructure. As long as we were in closed economy, we don't have any source to start any corporate system. So Apollo and Pratap Reddy and 4 daughters, I wanted to appreciate Pratap Reddy Garu. Real woman empowerment he has shown. His 4 daughters, Preeta, Sunita, Shobna and Sangeeta, 4 pillars of the hospital, Apollo. So woman empowerment అనే దాన్ని చాలామంది మాటల్లో చెప్తుంటారు. ప్రతాప్ రెడ్డి గారు కేటగారికల్గా వాళ్ళ కూతుర్లను ఒక ఎంటర్‌ప్రెన్యూర్స్గా ఈ సమాజానికి ఉపయోగపడే బాధ్యత గల పౌరులుగా తీర్చిదిద్దినందుకు వారిని మనస్ఫూర్తిగా నేను అభినందిస్తున్నాను. అపోలో అనే పదము నాకు తెలిసి వారు పెట్టింది కాదు, వారి కూతురు సునీత సజెషన్స్తోని అపోలో అనే పదాన్ని ఈ దేశానికి అందించింది. అపోలో అనే మాట కోట్లాది ప్రజలకు బాధలో సమస్యలో సహాయం ఆశిస్తున్న వాళ్ళకు ఒక ధైర్యం, ఒక గుండె ధైర్యం అపోలో అనే పదం. యాక్సిడెంట్ కాగానే, యాక్సిడెంట్ అనేది ఎంత కామన్ పదమో అపోలోకి వెళ్దాం అనేది కూడా అంతే కామన్ పదం. ఎవరికైనా ఒక ప్రమాదం జరిగితే సో ఈరోజు ఎన్ని స్లోగన్లు ఎంతమంది వచ్చినా స్ట్రక్చర్ ఫౌండేషన్ హి హస్ క్రియేటెడ్ దట్ స్ట్రక్చర్ అండ్ ఫౌండేషన్. నౌ పీపుల్ ఆర్ బిల్డింగ్ ఫ్లోర్ బై ఫ్లోర్. సో సమాజానికి ఆదర్శంగా నిలబడి సమాజంలో ఒక గొప్ప పాత్రను పోషించిన అపోలో యాజమాన్యాన్ని ఈరోజు థర్డ్ జనరేషన్ ఉపాసన కూడా షీ ఈజ్ కంట్రిబ్యూటింగ్ లైక్ ఎనీథింగ్. షీ ఈజ్ ట్రైంగ్ టు బిల్డ్ దిస్ అపోలో హాస్పిటల్. నేను డిసెంబర్ 23లో పొజిషన్ తీసుకున్న. డిసెంబర్ 28 వరకు ఫస్ట్ టర్మ్ ఆఫ్ చీఫ్ మినిస్టర్గా ఉంటా. సో ఆ ఫస్ట్ టర్మ్లోనే మీరు 100th హాస్పిటల్ స్టార్ట్ చేసి ఆ ఇనాగరేషన్కు నన్ను పిలవాలని. సో ఐఎమ్ ఫిక్సింగ్ యూ టార్గెట్ 2028 December 3rd లోపల యూ హ్యావ్ టు రీచ్ యువర్ 100th హాస్పిటల్ ఆఫ్ అపోలో in the country. Maybe in Telangana, maybe in Andhra Pradesh, maybe in Bangalore, maybe in Delhi. I don't mind anywhere. Apollo is going to serve for the nation. Now the brand is national brand, international brand. We are trying to build the ecosystem. We have taken a policy, medical tourism policy. All these years, Telangana doesn't have any policy for medical education department. Now we have adopted our policy. Based on that policy, we wanted to improve, we wanted to give opportunities to invest, to expand their services. Hyderabad is the place for medical tourism. So I spoke to aviation minister. People wanted to come to Hyderabad, but they don't have direct connectivity from Middle East countries, some of the countries. They have told me that. So I have discussed with Prime Minister and Aviation Minister. From Middle East to even Bangalore, Calcutta, we need more direct connectivity. So we are trying to get that, and we wanted to create a health, tourism, medical hub. So we are going to construct a future city. We are trying to construct a future city near to airport in 30,000 acres. There we have earmarked for the medical facilities with international standards. And we are interacting with airport authorities to give green channel for patients. They need not to stand in the line of the permissions and other clearances. They have to give single clearance. They have to allow ambulance up to a flight. Then the patient is going to get easy access. All these issues we have noticed. We wanted to take up next level. మనకి ఫార్మా హబ్ ఎందుకు వచ్చింది అని అంటే 1960s, 70sలోనే ఐడిపిఎల్ ఇక్కడ ఇందిరాగాంధీ గారు ప్రారంభించడంతో నౌ వి హావ్ సీన్ రెడ్డి ల్యాబ్స్, అరబిందో, నాట్కో, యూ నేమ్ ఇట్ ఎనీ, ఇండియాలో ద బెస్ట్ ఆఫ్ ద బెస్ట్ ఫార్మాస్ ఎందుకున్నాయంటే ఇక్కడ జీనోమ్ వ్యాలీ. అవుట్ ఆఫ్ ఫోర్ కోవిడ్ వ్యాక్సిన్స్ వీ హ్యావ్ ప్రొడ్యూస్ 3 కోవిడ్ వ్యాక్సిన్. సో ఆ రోజు ప్రభుత్వం తీసుకున్న ఒక విధానపరమైన నిర్ణయాల వల్ల ఫార్మా హబ్ 40% బల్క్ డ్రగ్స్ ఎక్స్పోర్ట్స్ మన స్టేట్ నుంచి జరుగుతాయి. ఇండియాలో నుంచి ఎక్స్పోర్ట్ అయ్యే బల్క్ డ్రగ్స్లో అవర్ కంట్రిబ్యూషన్ ఈజ్ 40%. ఈరోజు ఈ దేశంలో వైద్యం అందించే దాంట్లో కూడా మోర్ దాన్ 50% తెలంగాణ నుంచి ఉండాలి అని అంటే ఈ హాస్పిటల్స్ కానీ ఇవన్నీ అభివృద్ధి జరగాలి, బెస్ట్ ఆఫ్ ద బెస్ట్ ఫెసిలిటీస్ రావాలి. దీనికి సంబంధించి రాష్ట్ర ప్రభుత్వం తరఫున ఎలాంటి ఆలస్యం లేకుండా విధానపరమైన లోపాలు లేకుండా మా ప్రభుత్వం నిర్ణయాలు తీసుకుంటుంది. నేను చాలా సందర్భాలలో నా కలీగ్ దామోదర్ రాజనరసింహ గారి గురించి నేను చెప్తా ఉంటాను. బై ఎడ్యుకేషన్ ఈజ్ ఎ ఇంజనీరింగ్ గ్రాడ్యుయేట్, బై నేచర్ ఈజ్ అన్ సోషల్ డాక్టర్, ఈ నో హౌ టు ట్రీట్ ఎ డిసీజ్. ఆ పాలసీలో రెగ్యులర్గా నా దగ్గరికి ఎవరికైనా కొత్త అంశాలు చెప్పడానికి వస్తే నాకు కొత్త నేర్చుకునేంత సమయం కానీ సందర్భం కానీ లేదు. మా దామోదర్ రాజనరసింహ గారి దగ్గరికి వెళ్తే ఆయన నేర్చుకుంటాడు, అర్థం చేసుకుంటాడు, మాకు అవసరమైనప్పుడు సపోర్ట్ చేస్తుంటాడని. మీ మెడికల్ అండ్ హెల్త్ డిపార్ట్మెంట్ యాజ్ ఎ మినిస్టర్గా ఒక సోషల్ డాక్టర్ని మా ప్రభుత్వం అపాయింట్ చేసింది. మీ ఎవరికి ఏ ఇష్యూస్ ఉన్నా కూడా డైరెక్ట్గా దామోదర్ రాజనరసింహ గారిని రీచ్ అవ్వచ్చు. ఈ ప్రభుత్వం ఎప్పుడూ మీకు అందుబాటులో ఉంటుంది. ఈ ప్రభుత్వం ప్రోత్సహిస్తుంది. ఈ ప్రభుత్వం మీ పెట్టుబడులకు భద్రత కల్పిస్తుంది. భద్రత కల్పించిన మీ పెట్టుబడులకు లాభాలను చూపిస్తుంది రాష్ట్ర ప్రభుత్వం. మీరు తెలంగాణ మీన్స్ బిజినెస్ కమ్ అండ్ ఇన్వెస్ట్ అండ్ సర్వ్ ది స్టేట్ అండ్ నేషన్. థ్యాంక్ యూ.
That was fantastic, Andy. Thank you so much.
Sir, we have a special recognition. We are deeply grateful to Ms. Upasana Kamineni for her inspired introduction of biophilic design, which has transformed the hospital into a space of serenity and purpose, where clarity in care and calm in every step are not just ideas but a lived experience. So I would like to call Ms. Upasana Kamineni on stage for a special recognition from CM Garu. I request CM Garu, Chairman Garu and Health Minister Garu, Dr. Sangeeta Reddy to felicitate Upasana Kamineni.
Good evening. Honorable Chief Minister Sri Anumala Revanth Reddy Garu, Sri Damodar Rajanarasimha Garu, Honorable Minister for Health, Medical and Family Welfare, Dr. Pratap C. Reddy, Founder and Chairman of Apollo Hospitals, Dr. Sangeeta Reddy Ma'am, Ms. Upasana Kamineni, distinguished guests and members of the media. It's my honor to close this special occasion's proceedings with a word of thanks, a genuine expression of gratitude from everyone at Apollo who has worked to bring this hospital to life. Honorable Chief Minister, sir, your presence here today carries significance well beyond the ceremonial. Today's occasion is a reflection of your commitment towards healthcare and education, which are the two pillars the government focuses upon. Honorable Health Minister, sir, your presence here today is deeply valued. You have been closely engaged with strengthening healthcare in this state, and we look forward to continuing our partnership with the government of Telangana. We are deeply grateful to our chairman, Dr. Pratap C. Reddy sir, without whom none of us would be here. Thank you, everyone.